Welcome to America's Heroes Group.
And welcome back to America's Heroes Group with our roundtable and our partner, the Veterans Health Administration. April is Sexual Assault, Minority Health, and Autism Awareness Month. It's Saturday, April 29th, 2023. Our host is Cliff Kelley. I'm Sean Claiborne, the co-host. Our executive producer is Glenda Smith. A digital media producer is Ivan Ortega, Scott Turner Productions, and also Shakaya. She's our studio engineer, our technical producer, and also filling in as our executive producer today. We have a panelist, Michelle Spivak, former Senior Communications Officer for the Veterans Health Administration, Office of Communications, and Kenneth L. Heyward, Masters of Health Administration, U.S. Army Signal Corps veteran and management analyst with the Veterans Health Administration Office of Integrated Veteran Care in Washington, D.C. And we're going to talk about the American Red Cross, the things they're doing for veterans, particularly when it comes to blood, because there's a lot of blood going around this country, but we need more of it to keep us going and to keep us alive. We're going to talk about that and all the particulars about that. How you guys doing today?
Nice
doing well. Well, thank you. Thank you for having us.
So, Michelle, lead us off. Tell us what is going on with the American Red Cross, and what is our condition as far as the need for blood in America?
Well, first of all, thanks so much for allowing us to talk to you about this very important topic. You know, there is nothing in healthcare that can replace blood. Blood is a unique substance that is needed, and there is no chemical way to derive it. You must have blood for healthcare. Right now, we are in nationwide a really tough position because we don't have enough blood donors. And it all started, of course, pre-COVID, but COVID made everything a lot worse. Do you know that only 3% of Americans are blood donors, but 60% of Americans would qualify to give if they would just step up and give? So we are together, Kenneth and I, and our team at the Department of Veterans Affairs that are working on the Roll Up Your Sleeve campaign. We're reaching out to your audience today to encourage them to consider being blood donors.
So, Kenneth, how did you get involved with the Red Cross as a volunteer, and what personally led you to make that commitment to be a blood donor?
Well, actually, my first interaction with the American Red Cross was back in 1995, while I was actually still serving in the United States Army when my unit was deployed to Operation Uphold Democracy in Haiti. Unfortunately, my mother passed away during that time, but I received a Red Cross letter, an emergency letter, and I was on the first plane smoking back to Charleston, South Carolina. So that was my first interaction with the American Red Cross. And I was so impressed with the, again, no questions were asked, no monies were asked for. They made sure I got home, and actually they made sure I got back to, at that point in time, I was actually stationed in Hawaii. So that was my initial interaction with the American Red Cross. And since that time, initially it became just a must that I donated financially. So I would use the, through CFC, I started donating to the American Red Cross. But fast forward many years up into present day, I began donating just because, again, just knowing and realizing they say when you know better, you do better, right? So just knowing the crisis that the country was in regards to the lack of blood, particularly African Americans and Black people needing that blood supply to be amped up. I began donating. And so that's how my volunteerism became more active in that capacity. And then while serving as the chair of the Health and Wellness Committee with the 100 Black Men out of Baltimore, our president was contacted by the executive director for the American Red Cross of Central Maryland. And again, that covers that Baltimore City, Baltimore County area. And so we were approached I personally was approached with the invitation to join the board of directors for American Red Cross, and that's what I did. And so again, that just kind of amped up my donating, but then that actually turned into me spearheading through Blacks in Government, at that point in time, through 100 Black Men of Maryland and several of the local churches to actually spearhead probably about 7 or 8 blood drives.
Wow. So Michelle, can you tell us a little bit about what veterans can do to try to combat this shortage? Because blood is definitely necessary, and particularly it's very alarming if you go to the hospital and they have a shortage of blood. That you just mentioned it. That's the most critical building block, where you really can't go anywhere without blood.
Sure. So I want to say first, it's time for young people to step up. The age of most blood donors is parents and grandparents, to tell you the truth. We don't have enough young people. I also want to tell people that American Red Cross is one of two major organizations that collect blood. There's also an organization called America's Blood Centers, and that's an umbrella group for hundreds and hundreds of collection sites across the country. America's Blood Centers actually collects more blood than American Red Cross, but people don't know enough about them. So I want to urge people to consider, number one, giving blood, and number two, veterans. You've always saved us, and you've always been there for us. I ask you again to step up and help us by donating blood. And how do you do it? Well, the first thing you do is you check with your local VA hospital and find out when they're having their next blood drive. If they are having a blood drive that you can attend, I hope you will do so. If they aren't, you can go to the website for either American Red Cross or America's Blood Centers, and you can find out if there's a local blood drive going on in your community, convenient to your schedule. And if you go there and you say you're going to give blood for the Roll Up Your Sleeve campaign, that's hashtag Roll Up Your Sleeve VA, your donation will be attributed to this major campaign for veterans. But I want to make clear that blood goes to everybody. It's whoever needs it first.
Wow. Now, I know there's a lot of places popping up that are paying people to like sell blood and sell plasma to hospitals or wherever they sell it to. Do you know anything about that, and how does that compare with donating blood to as far as being able to get the blood to where it needs to go?
I really don't know too much about that, so I can't speak to that. I would hope that people who are in a situation where they feel they have to donate blood for money can find other resources, and I hope that our communities can help those sorts of people, because we wouldn't want people to be putting themselves at any risk at all because they're that desperate for money. So I can't speak to that, but I would urge anybody who feels, particularly veterans, who feel like they need to sell their blood, please go to a VA and please find out what resources are there to help you.
And so, Kenneth, can you add more to that, and also tell us a little bit about what roles that some of the organizations you participate in? Because I know you're participating in a lot of different organizations in helping the Red Cross collect blood, but through donation. So tell us about that, and also how important is that to you?
It's very important, and just like Michelle said, that there are several different ways that, especially veterans, because we're always, as veterans, we're used to serving, so we're always looking to do our part and help the community and help this country in any way that we possibly can. And so most times we'll once we either retire or just transition from the military, we're joining social organizations, especially the VSOs, VAV, VFW, religious organizations, ethnic and civic organizations. And so those organizations form as the basis for a lot of the work that's being done on the volunteer side through the American Red Cross in regards to blood donors. And that's just simply hosting a blood drive. That's one of the major ways that veterans, and again, any kind of other social organizations can do their part by hosting a blood drive. And they don't even have to, because I know one of the first things when I started not necessarily hosting, but actually spearhead blood drives, it's just a matter of actually finding some place to actually would hold the blood drive. And so that's another huge issue after since COVID, a lot of places, because most times when the blood drives were held, they were held in schools, they were held in churches, local gymnasiums, and so those types of places were closed due to COVID. And so now, when we would find a church that was willing to open up their doors to us, or and then again, when you're talking about schools and publicly, facilities that had oversight with city and local government, those are kind of a different nature, so it was harder. But again, going back to blacks in government, going back to 100 Black Men, going back to the Divine Nine, going back to any of these other service organizations, again, DAV, VFW. The last time I gave here in Maryland, I gave at the Elks, one of the Elks Lodge in Maryland. So all of these organizations, again, and the great thing about it is all you have to do is show up, right? And even as an organization, the Red Cross will do everything else. They'll have all the staff. They'll bring the last blood drive we did that Michelle helped us with at VA headquarters. All we had to do was just show. That was super successful. And again, all we had as volunteers, as big as blacks in government, all we had to do was show up. They even had individuals to serve as registered. The only thing that we had to do was, as volunteers, is as like at the refreshment table, when donors came, completed their donation, give them some water, make sure they sat down, and for the 15 minutes that they needed to be refreshed before we knew that they were good to leave. So it really is not that much of a burden when you're talking about organizations hosting. And again, you can host the blood drive, but you don't even have to necessarily use your own facility. Like Blacks in Government, we don't have a specific location, but again, we were able to use the central office. Through 100 Black Men, we were able to use a couple of the churches in Baltimore, churches in Townsend. So again, it's just a matter of just reaching out to local facilities, pastors, local leaders, and just letting them know what your organization is trying to do. And I guarantee, especially now, since we're the country has opened back up, a lot of the same facilities that were once closed before are now, willing and able to allow organizations to come back and to utilize their facilities for free. And it's not like they're asking for any money most times in your schools and again, church conference rooms and things of that nature.
Now, Kenneth, you are a healthcare policy expert, essentially. You write, analyze, and interpret policy, and you also have a focus on equity and diversity. How does that play into the scarcity of blood, and also when you break it down between African Americans, Latin Americans, Asians, Caucasians, how does that play into the socioeconomic part of the necessary, important health need of blood and getting blood to the communities, getting more Black people to give blood?
Well, the numbers don't lie. And so all we do is we put out the numbers that, the percentage of African Americans that, are here in in terms of population here in the country, versus the number. And again, we're talking about sickle cell. Sickle cell month is coming up in September. So we're talking about sickle cell disease. That's a disease that primarily, attacks, those of, Black and of African descent. And so, just putting that message out there, and then putting out the message that it's more than likely that someone of your own ethnicity, you can be a better match when you're talking about blood donations, when you're talking about blood transfusions. You just kind of put that out there, and when they hear those stories about how important it is for because again, if you know better, you do better, and then just the education too, right? We allow our the experts from the actual, from the Red Cross, the paid staff, those who, have all the real numbers and statistics, and do this on a daily basis. We allow them to, to do webinars, to provide us with information and put the word out there, and then we just serve as that conduit to try to facilitate that information and really just kind of stress the fact that how important. Again, I forgot at least one out of, I can't, again, I don't want to quote anything that I don't, statistically, But the vast majority of every American will need blood at some point in their lives. We're not just talking about blacks. We're not talking about race, ethnicity. We're not talking about color or anything. Everybody at some point in their lives, unfortunately, if not yourself, definitely somebody within your family is going to need blood. And so we just try to hammer that point home. And it's really not about policy. It's really not about it's not about it's not about the government. It's not about anything that that's super it's not rocket science.
Right. It's just a fact of the matter. You're going to probably at some point in your life, if you live 78 years, hopefully, you're going to end up in a hospital one day. You might need surgery.
Right.
Then that's going to be.
And every donation that is given can save up to 3 lives.
Wow.
So you really are a lifesaver when you do this. And let me also add, you cannot get COVID or give COVID from a blood donation. And you can make a blood donation if you've had a tattoo or two. Tattoos do not mean that you can't donate blood. And if you're gay, you can give a donation. So there are a lot of things that people used to believe or that might have been rules way back when. And now we have ways in which we can find out if that person is generally healthy. Yes, they can be a blood donor. And if you can't give blood, I was signed up to give blood at the big blood donation, and my doctor said, not right now because you're going to have some surgery soon. So if you can't, you can always volunteer to help out. You can help find a place for a blood drive. You can do some of the marketing and pitching and sales, the PR for the blood drive. There's always something that you can do. And remember, we're all in it together when it comes to this. So I'm really happy. And first, I want to thank Kenneth because I hadn't seen you live and in person, and I'm really
right, exactly.
I want to thank Big for getting on board and holding that blood drive, and I want to encourage everybody else to think about holding a blood drive, sponsoring a blood drive, and stepping up to give blood.
I think that's really important because you mentioned that something that's also, if you don't necessarily have to be the person that gives blood, you could be the person that facilitates, is organizing your friends or organizing an event, maybe at your workplace, to try and give blood and donate blood, because it's such a critical thing. It's something that's so necessary. On the point of sickle cell anemia, 2% have a rare blood type used to treat sickle cell. And then at some point, I guess if you have sickle cell, you're probably going to need blood transfusions to stay alive. Yeah. I guess that since it's so rare, it's really important that we flood the market basically, if we can, with all the different types of blood. Now, I'm not sure if any of you have the answer to this question. I'm not a doctor, and you guys aren't doctors, medical doctors, but I know most people have O positive blood. I'm an O positive person myself. Why is there such a shortage of O positive blood? Because that's the most desired blood type that hospitals and the Red Cross needs.
I don't know why there's a shortage in particular, but that's the universal donor, isn't it?
Yes.
I think that's the universal donor. Yeah. I think just in general that it's one of those things where you sort of expect it's always going to be there, and you count on other people to do it. And right now, we're in a situation where we all have to take a little bit of responsibility to be part of the solution. And to do this on a regular basis, the way Kenneth and his team do, I mean, they do it, what is it, like every 90 days you can give, where you have to build up your...
Yeah. 50, I think it's 52 days, 56 days, I want to say. Every 56 days, I think you can donate.
Now, is it a
and
good
I would
idea?
love to see some blood drives on college campuses now that colleges are open. It would be great to see some younger people. You can give when you're 18 years old or older. So it would be wonderful if young people would get on board with this.
Does it make a difference if the person is younger or older when you give blood?
No, but you have fewer... As you get older, you have more complicated health issues. Okay. So it would be wonderful because most young people are in generally good health, and we would be able to get more blood donations that way.
Okay. And then, and also it's a good idea for people to see a doctor, but to get maybe pre-screened or qualified to give blood, or can you rely just on the facility you're going to, the Red Cross or whomever, to check to make sure you're healthy enough to give blood?
They're going to ask you a series of questions to screen you when you get to the donation site. And then they oftentimes will also test a little drop of blood. Kenneth, do you want to share how that happened, how that went at the recent blood drive?
Yes, and you're exactly right, Michelle. So there's a comprehensive exam that's done via questionnaire and also via the blood sample that's given, and you get it on the spot. And if there's anything that that they find, like I know one of the individuals wanted to give, but her iron level was low, and so she wasn't able to give. And so we just kind of pick up on things, instantly to allow individuals to know where they are, health wise, and then to come back and go back to their primary care provider or physician, kind of seek some advice and guidance on how to get the iron level up, so they next time they present to donate blood, they'll be able to do so. But yeah, there's again. And for COVID, I know a lot of people were concerned, but they were testing. At one point, the Red Cross was actually doing on-site testing for COVID to make sure that all the individual, the donor, as well as the blood that was being donated was good for to be sent to whatever facility for processing and sending out to those who are in need of the donation.
And I think that's important too, because oftentimes when you do these types of activities, a hidden benefit or a collateral benefit is you find out something about your body that you didn't know before.
Right.
Like if you have COVID or if you have low iron, maybe you're anemic. That could be something that's critical. Now
I've seen that.
Wow.
An individual who was just so anemic that and he didn't even realize it, that he eventually had to go and start to get and ironically he had to get blood transfusions because his iron was so low. Yes.
Wow.
Yes, but he would not have known that had he not gone to donate blood.
Wow. Now, Kenneth, you're living in Bowie, Maryland now, right?
I am. Yes.
My old stomping grounds. That's where I was born. Not born there, but I was born in D.C. But I grew up. I spent my high school years in Bowie.
Okay.
So if you've gone to Rips over on 197 and 301, Rips the deli.
I actually used to live almost literally behind Rips, off of Governance Bridge Road.
Yeah, it's still there all these years. Like this is like 30 years ago.
Oh yeah.
I went over there and tried to apply for a job one time. I was like in middle school or something like that. That was pretty cool. And also, you did you come from Charleston, or were you born?
Born and raised in Charleston, South Carolina.
That's why I was in Fort Jackson. That's where I did my basic and AIT. I did that in Fort Jackson, Charleston, South Carolina.
Okay.
The world's smaller than we think it is.
Right, exactly.
I also lived in Charleston, South Carolina when I was a kid.
Wow.
Yeah, in walking distance to the Citadel. You know the Citadel, right?
Wow.
Oh yeah.
That's
probably off of Rutledge Avenue or somewhere down there.
That's right.
So, Michelle, what would you say? What was the one last push you would say to encourage, particularly younger people? And I bring this up not just to just young people in general, but particular service members, because you have health people that go into the service are going to be pre-screened for a lot of stuff, right? And we get all the shots, immunizations, and everything like that. I mean, chances are, if you're in the military, you don't have HIV. Chances are you don't have any STDs. Chances are you're in pretty good shape. What would you say to encourage veterans and service members to take advantage of the opportunity to step up and do something really heroic, and also increase this blood supply and solve the shortage problem?
I would say, because I know that veterans really want to support each other, I would say that your fellow veterans need you, that the freezers are running bare, and a lot of hospitals around the country have about 2 days supply, sometimes 3, and that is not enough. So I would ask you to serve your country, again, by being a blood donor.
Great last words. I appreciate your time and all the things you've told us about, and hope that we get ahead of this and people reach out to the American Red Cross, also reach out to your local organizations. See if you can also become a person who can set up an event to donate blood. So we have Michelle Spivak, former Senior Communications Officer, Veterans Health Administration, Office of Communications. Kenneth L. Heyward, U.S. Army Signal Corps veteran and management analyst with the Office of Veterans Health Administration, Integrated Veteran Care in Washington, D.C. Thanks for you guys' times.
Thank you so much for having us.
Thank you. Thank you for having us. We appreciate it. Take care. Right,
this is
bye-bye.
America's Heroes Group. We're signing off again one more time on Saturday, 4 to 6 every Saturday. Check out our website, americashg.org. That's americashg.org. And if you have any questions, send it to info@americashg.org. And we can also respond to your questions. And if you want to come on our show and talk about some of the things you're doing for the veteran community, be our guest. Come on. And once again, I get my card out, so I don't memorize all this stuff. The card says, I'm doing Johnny Carson now. The card says that you need to call us at 312-803-2618. That's 312-803-2618. Or go to americashg.org. See our shows on Facebook. See our shows on YouTube. We have an archive of shows that go back many years. And you can find about topics about this topic, other topics, PTSD. Let us know. America's Heroes Group, we're signing off. See you next week.